let's talk about implementation for health systems and pharmacies. What's the typical time frame? What does that look like?
Yeah, so it's very easy. It's typically around 30 days. So when somebody comes to us, so health system, pharmacy, and they're ready to be implemented with LSPedia, the first thing we do is we understand who their suppliers are. So who they're ordering from, whether it's directly from the manufacturer or the wholesaler. And then on our end, we have our implementation team start to establish AS2 connections with those vendors so they can start to receive that serialization data into our system. So I would say typically, if you're ordering from, let's say, 50 to 100 suppliers, you could be onboarded in around 30 days.
Okay. System. So LSPedia has over 150,000 AS2 connections that we've established over the past 8 years. So is the reason that we're able to onboard a system with so many suppliers so quickly because of those connections?
Yeah, absolutely. So a lot of our competitors, so typically when we get a health system switching to LSPedia, it's not uncommon for them to be signed up for 6 months, 8 months with these other vendors, and they're only connected with 1 or 2 suppliers out of 50 or 60 suppliers, because these other vendors or other competitors of ours, they don't have these existing AS2 connections. But we've been working with DSCSA for over 11 years now, and we've been exchanging EPCIS data for 6 to 7 years between manufacturers and wholesalers. We already have these connections set up, so it's very easy for us to get a pharmacy or a health system connected with their suppliers and up and running very quickly.
So essentially, it's just a flip of a switch.
Yeah.
We need to know what suppliers they have. We turn those connections on in our system, and then we notify the supplier, hey, you can start sending EPCIS data to this GLN through this connection.
Yeah. Data starts coming in, and then we validate that data. So that's where that additional time comes in, is we do have to validate that data, because there are times where one of your suppliers, they're sending data and it may be missing a transaction statement, a change of ownership. So there are some required fields that need to be in that EPCIS document. So we will work with your suppliers to make sure that that connection is valid and the data is correct coming in. And then once we verify that connection, we'll push it towards production and you'll be good to go.
Excellent. So that's EPCIS through an AS2 connection.
Right.
Can LSPedia facilitate ASN?
Yeah, absolutely. So there's, some of our competitors, they're working with different pharmacies or health systems, and they're utilizing ASNs right now because they may not have the EPCIS connection set up. So sometimes when we transition a health system over to make sure that they can continue to do what they're doing right now, we set up ASN connections, and that allows them to receive that lot level data. They can scan against it. They have the documentation inside of our system for compliance purposes while we get them onboarded for that month, with EPCIS.
Yeah. Okay. And what about health systems that have, like a paper T3 or shipping notice that they want to track or upload and turn that into an electronic document? Can LSPedia facilitate that?
Absolutely. So we have upload functionality inside our OneScan platform where you can upload that document into our system. We'll store it for you. It's readily available for auditing purposes. And so you'd be good to go if that's your current process.
Great.